Today is August 24th, 2016. Kay Wagner is talking with Dr. Michael Garrity, a retired Gunderson family practice physician. And Dr. Garrity was also in group practice with Farrell Clinic in Prairie du Chien from 1960 to 86 and continued his practice with Gunderson Farrell from 1986 to 2000, totaling 40 years of service. Welcome, Dr. Garrity.
Thank you. Thank you.
We're pleased to have you here today.
Nice to be here.
And Pete Hawk is behind the camera for medical media. Do we have any corrections or additions to the introduction?
No, none at all. That's very accurate.
Okay. You grew up in Prairie du Chien.
Yes, I did. Born and raised.
Born and raised. Tell us about your family history and background.
Well, my mother and father are both from the area. My father was a businessman in Prairie du Chien, and my mother a housewife. I had two brothers and a sister, and we all finished our schooling there. I was fortunate enough to have Campion High School, a Jesuit boarding school there when I was growing up, and I was a day student there, and I think that had a very profound influence on my education.
How so?
Well, it gave me a love of study and a love of questioning and not taking things verbatim, but making sure that I felt there was a real reason for what I held important and valuable.
Was it an all-boys?
All boys, yes.
I went to an all-girls Catholic high school under the Benedictines.
Well, then I don't have to tell you really anything about that. Yeah.
Well, I do agree. I felt like I really had a valuable studying background from that whole experience. Yeah. Is it still there?
No, closed in 1975. It's now a state prison, and when I told the last principal that they were changing it to a prison, he said they wouldn't even have to change the handbook. So,
how about any lessons learned or challenges in your childhood?
well, my father and mother both came from the Depression, and so work was always important. I don't ever remember a summer from the time I was probably in 5th or 6th grade when there wasn't something to do. And then also a very profound impact on my childhood was World War II. I had a brother who was overseas and an uncle, and so I lived with that worry. And then in a small town, we were very well aware of the boys who were wounded or lost, and we had a very close friend, pilot, lost over Italy, and then my sister-in-law's brother was also lost in the Air Force, and so those things had a profound effect on me.
What did your siblings go on to do in life?
My sister was an educator and became the assistant principal of public schools in Prairie. My older brother was a salesman for Standard Oil, wound up here in La Crosse, as a matter of fact, and my closest brother, 10 years older than me, was a funeral director in Prairie du Chien.
I wondered about that because when I was doing some research, I saw that there was a funeral home named. Describe your educational background for us.
Well, I went through grade school and high school in Prairie du Chien, and then I went to Marquette University, and I was there for a year, and I intended at that time, believe it or not, to be a funeral director. And so I left after 1 year at Marquette because you had to have a year of apprenticeship in funeral directors, funeral directing work, in order to go on to mortuary science school at the University of Minnesota, which is where I planned to go. It's where my brother had gone. So I dropped out and I worked for almost a year at the Daily Funeral Home in Beloit, Wisconsin. And then the Korean War was going on and I went into the Air Force.
And how much time did you spend with the military and the Air
2
Force?
years.
2 years.
Yes, and that they probably are the reason that I went to medical school. I worked for 2 officers principally for 2 years in the flight surgeon's office, and they both encouraged me to consider medical school. They said to me, "You like this stuff, you got the GI Bill, why don't you go to medical school?" And changed my career orientation completely.
Were you glad that you made the choice?
Absolutely.
So that partially answers the next question on how you decided to become a physician.
Mm-hmm.
These 2 gentlemen, did they serve a mentorship type of role or role model for you?
Well, I worked principally with the 2 of them, and right up till I was separated from service, they encouraged me, and one had been a professor at the University of Iowa, and he really encouraged me a lot and said that I should stay in touch with him, and he would write a letter of recommendation when I applied to medical school, and indeed he did. Both of them did. So yeah, they maintained a mentorship on me until probably into my 2nd, 3rd year of medical school.
Were there others that inspired you along the way as well?
Not like those 2 did.
Mm-hmm.
They really took a special interest. I think we had a small unit, and we had only 110 people in our medical unit, and so the officers and the enlisted men had a very non-traditional military relationship. We were friends, and we spent time together, not so much socially as working, but they took a real interest in what we were doing. Not just myself. I think everybody in the outfit had that feeling.
How did your experience with the military help to shape you to who you are today?
Well, certainly it teaches you a discipline and a regimen of how you should handle your life and your planning. And then the GI Bill was an enormous help, along with jobs I had at Marquette. I know the medical students and the debt they come out of school with today. I came out with basically no debt at all because I had a job at Marquette and the GI Bill, and that basically took care of things.
You were familiar with Gunderson Lutheran. How did the affiliation come about in 1986 with Prairie du Chien?
Well, we had a very unusual situation. We had 2 older partners. I was kind of in the middle, and then we had 3 younger partners. And the older partners were anxious to get out and retire. The younger partners were not anxious to invest in expansion of the practice. The rules and regulations were becoming very burdensome. And so the consensus was we should search around and see if someone would be interested in affiliating with our practice, taking control of it. Anxious to get out of administration and things of that nature. We were hiring most of that done. We let it be known in the area that we were interested, and a couple of different people contacted us, and Gunderson pursued it very vigorously, and it worked out beautifully.
Was that Don Smith at the time? Or?
No, it was Carlson and Sig 2.
Okay. Were there any? What were the challenges?
Well, they were very few. The biggest one I remember is that we were very late in developing employee benefits in a small practice. But we did finally do it probably as soon as we had incorporated from the older two physicians to involve the younger doctors. And Gunderson had some hesitancy at the time about how to vest the people who were in our clinic into their clinic. And we simply had discussions about it and worked out beautifully. Everybody got the same level of benefits that they had at Farrell Clinic.
How did this affiliation differ from other affiliations that you saw take place, or maybe you don't know?
Well, I think that Gunderson, from the very beginning, had an appreciation for small rural practices that other clinics in the area did not have. They saw it being managed and run from, other clinics saw it being managed and run from kind of the central office, and everything was pushed down. With Gunderson, with Sig 2 particularly, and Phil Dahlberg, and Kermit Newcomer, who were the presidents that I served under, they valued the opinion of the regional clinics. And we actually had a committee that met once a month of all the medical directors. And they set the goals and policies for the regional clinics. So they felt very much in control of their own destiny.
I think you described it in one article I read that's taking away the headaches associated with the business of responsibility in the practice of medicine.
Yes,
Yeah.
yes, very much so.
Describe a typical day of a family practice physician.
Well, I think it's probably the same. It's changed some. But in a small town when I was there, we started out every day with hospital rounds. And that would generally take an hour to an hour and a half. And then usually between 9 and 10, we would start our office hours. And on the average, probably see a patient every 15 minutes. Our schedule was very flexible. Obviously, there were people that took more time and people that took less, but the scheduling was generally 4 people an hour. Standard noon break, 1 to 12 to 1, and then back 1 to 5, and then rotation of call. At that time when I started, we covered the emergency room and our own nighttime call, so it was a long week.
What were the typical complaints of patients? Was there a theme?
No, it covered the gamut of everything. We did full practice. We did obstetrics, minor orthopedics, emergency room, suturing, biopsies, stuff of that nature. And then we had an excellent relationship with specialty referrals. And that came about just as I joined Gunderson. The referral services developed a service called MedLink. Mm-hmm. And Eric Gunderson was very instrumental in that. And the regional clinics could then, regional physicians could call in to a central phone number needing help from specialty, be it cardiology, neurosurgery, whatever. And you would stay on the phone until you had that physician on the other end of the line. And then their first effort was to try to help you manage the patient in your own setting. And if that seemed less than ideal, the patient would be transferred here.
And as I recall, that was a 24-hour service.
Oh yes, 24 hours, you bet.
What have you seen as the biggest advancement in family practice medicine over the past 20 years or so?
Well, I think the fact that in 1968 there was this transition from general practice to family practice. And the general practitioner, I think, probably lost something in that era of respect in the field of medicine. I recall that I had applied for and was accepted into a surgical residency, and then my family doctor, Dr. Farrell, came down to Milwaukee and talked to me and said that he needed help for a year and would I come out and do family practice with the general practice with him. And then his brother was the head of surgery at Miami, and he said, if you still want to be a surgeon, Jack will take you down to Miami. Well, I went back to Marquette and told the people that I had decided to help Dr. Farrell out. And I remember the head of surgery at that time said, you're going to waste your life in general practice. And so that was kind of the attitude. Well, then family medicine replaced that, and the excuse me, the boards were developed in 1972 for specialty recognition, and they have been a leading example since then. They do not grandfather anybody in. They require recertification, not just certification. And they set some pretty tough standards. So I think they've done a marvelous job of bringing family practice to a place where it's recognized and respected today as a specialty of its own.
And in my memory, wasn't part of that for the family, encompassing the family in terms of care and treatment?
Absolutely, yes. That's correct.
Anything else that stands out as far as like treatment of hepatitis C or management of infections, those type of things that have come along?
I think of this because I just talked to one of the gentlemen yesterday. When I came out in 1960, if you had a coronary, you came to the hospital and you stayed in bed for a week. Then we dangled you for a few days, and then we got you up, and then we eventually gave you a wheelchair, or rocking chair, and sent you home. And this gentleman I talked to yesterday, he and one other, the gentleman yesterday, Floyd, is 19 years post-heart transplant. And the other is 20 years post-heart transplant. And both are doing very well. And when I think of that dramatic a change, it's amazing to me. So I had the privilege of training. I was an intern when he was a second-year resident with Dudley Johnson, who developed the coronary bypass. And so there have been such dramatic changes that nothing I could have imagined in 60. And I thought we were pretty good in 60, but little did I realize how far we had to go.
Well, you have an admirable resume of board work. You served as Chief of Staff at Prairie du Chien Memorial Hospital and Board of Directors for 12 years. You chaired the Family Practice Department at Gunderson and were chairman of the regional clinics and on the Board of Directors for Gunderson Lutheran. Were these satisfying roles, and can you share some memorable moments?
Well, the chairman of the Family Practice Department was very transient. It was a one-year span of time because they were trying to get family practice organized and off the ground, and probably the time that I spent most in family practice and administration was as chairman of regional clinics. And we were bringing clinics on board then. We already had Viroka and West Union, and brought on Whitehall, and so those areas were growing, and we were trying to meld them so that they would communicate together and function together. And I think we did a really good job. We had annual meetings here where all of the physicians in the whole area would come in, and we would use that time to get the family practice people, the regional people together. And it really was was very beneficial. And then I think one of the finest things I remember about my association with Gunderson reflects back on the time that SIG II was president, and I was chairman of the regional clinics, and we had, I think, 68 family docs out there at the time. And anytime a problem would come up, and you were bound to have them with that number of physicians, his directive was never go out and do this, this, and this. It was always go out and find out what's wrong and what we can do to help the person. And he was very sincere in this, to the point where I saw him 3 or 4 times make special efforts to see that the physician was given whatever care or help was needed. And it just impressed me so that there was that much care for the organization and the people who made it up, and I was always impressed with that.
Well, your volunteer work is equally impressive. When we visited in the Linda Smith Center the other day, you spoke of the Ukraine partnership.
Yes.
And why don't you talk about that, because that's very interesting.
Well, that was probably one of the more enjoyable and profitable things I ever did. Just as I was retiring, Sandy McCormick, who was head of the Lacrosse World Services Group and who had worked previously with the group here in Dubna, Russia, approached me and said, would you be willing to give a couple of weeks a year to a project in Ukraine? And I thought, sounds interesting, sure. Well, it turned out to be, I'm sure, 2 to 3 months a year. But we made 9 trips over there. Kermit Newcomer was the other physician I traveled with mostly, and Sandy and Mary Anderson, all Gunderson people. And our job was to establish primary care clinics, help them establish them. And basically what it amounted to was the Ukrainians would take the building. We'd help them choose it, and then they would fix it up into a clinic setting. We would bring in the equipment, and then their doctors and their nurses had no concept of working together. Somehow it seems impossible that they wouldn't work together, but they just didn't. And so we then showed them teamwork in medicine and gave them projects to work on that would bring them closer together. And we made 9 trips over there, and they made 9 trips over here in 4 years. And we established one clinic at the Air University in Kharkiv. And there are now, I believe, 24 university clinics that have been built off of that model. We established one small town clinic in Korobishkina, and there are over 200 small town clinics that were built off of that model. And they were just terrific people to work with, because it was the old teach a man to fish observation. We gave them the opportunity, and they saw it and took it and ran with it, and we helped equip only the first 2 clinics. After that, they did it all on their own. And so knowing how well they responded to that stimulus was very gratifying.
It sounds like a wonderful experience.
It was. And then their trips here were just as rewarding. We worked with the same people all the time. We really got to know them, and I still hear from a couple of them, particularly at Christmas time and on the 4th of July, the United States birthday. They always send me a happy birthday card. So.
And you've worked at St. Clair Mission for 14 years?
14 years, right. Yep. Started in 2002 and worked every Wednesday until this year. Now we're working the first and third Wednesdays.
What is the typical patient come in for at the clinic these days?
Well, there are walk-in clinics on Tuesday and Thursday night, which they take care of anything that walks in. And then once you have a chronic disease, diabetes, hypertension, arthritis, depression, something of that nature, they're put into what's called a continuity clinic, and that's the Wednesday clinic, and that's the one that I work with. And so we're pretty much a well-established group now, mostly retired. One of the nurses looked in one day, and there were 4 or 5 of us sitting there, doctors, and she said, "This looks like the Gunderson Clinic Retired Physician Support Group." And Jack Lockhart said, "I think it is."
How long do patients typically stay in the I can't even say the word, but in that continual care?
I've seen people for all the 16 years, not many, but or 14 years, but I would say the biggest loss of patients was over the last 3 or 4 years, when they made a real concentrated effort to get people with chronic illnesses into the Affordable Care Act.
Okay.
And so that's why we went from every Wednesday down to first and third. Our population dropped. But no, I've seen people for years and years, and so again, the relationships are very fulfilling and gratifying.
Are they providing dental care?
We provide it, but not at St. Clair's. They have to travel for it.
Okay. To Gunderson or elsewhere?
No, I think right now there's a state clinic up in, I want to say Westby, but I'm not sure of that. But anyway, there is a clinic that is being run by the state for free dental care.
Okay. And you
Cashton, maybe.
Cashton.
I'm not sure where it is.
You were a team physician for the Prairie du Chien High School for 27 years. That must have
Yes.
been fun.
It was indeed, yes. Yeah. And Campion for 15 years.
And the medical director of Crawford County Public Health for 20 years.
Well, that was pretty much a title. You don't have to do an awful lot to be the county director. But those were all, enjoyable things. That was my hometown. And so I got involved in lots of things, and it's kind of funny, when I went back there, I actually thought probably I'd starve to death, because I grew up there, and I wasn't a bad kid, but I wasn't the most perfect kid either, and I thought nobody will ever come to me as a doctor. But the first patient I had was one of my classmates brought her child in for me to see, and then I started seeing friends' parents, and pretty soon friends, and so I always said my friends became my patients, and my patients became my friends. And in a small town, that's, to me, the biggest advantage there is.
Mm-hmm. You've received several prestigious awards, including the first ever Legacy Award from the World Services of Lacrosse
Yes.
for your lifetime achievements in Prairie du Chien lacrosse and internationally. How special was that?
Very special, totally unexpected, and it was certainly frosting on the cake, because I thoroughly enjoyed the work in the Ukraine and the work here. I've loved being a doctor, and so recognition like that is always special, and my entire family was here, and it was very nice.
Well, you mentioned that you'd made 9 trips to the Ukraine between 2000 and 2004, and I think you talked at least a little bit about the family medicine education program that you and Dr. Newcomer
Yes.
started. Is there anything else you'd like to add about that?
No, I think that they were so ripe for that stimulus at that time. I can't think of anybody over there we worked with that we weren't terribly proud of. one of the nurses who Mary Anderson and Sandy had worked with became basically a nurse practitioner, and she started a nursing association for the entire, first of all, for the oblast, or the state that she was in, and then it eventually involved all of Ukraine. And she went up and took international certification as a nurse. I don't know where that exam, I think it was given in Amsterdam or somewhere, but she came back and just pushed all the nurses to achieve, to really excel at what they do. And we saw the rates of hospitalizations drop. We saw the early treatments. I'll give you a classic example. This town of Korobishkina, we'd give them 2 projects to work on, and one of the Korobishkina ones was to see how many people had hypertension. It was a town of 2,800 people. And Kermit and I went down to talk to Nikolai Proskurnin, who was the physician there. And we said, how have you done with the hypertension? And he said, well, we've got everybody who has hypertension. I said, everybody? What do you mean? He said, everybody in the town. I said, you had everybody in the town come in? Well, all that could. If they couldn't, we went to their home and checked their blood pressure. And Kermit, I still remember, said, well, now, one reading isn't enough. He said, no, if their readings were elevated, we checked it again. So we checked it twice. So the next question was, well, how many people do you have on treatment? And he said, all of them that need it. And we were both amazed. And then he said, you know, we have our next study already picked out. I said, what's that? He said, we noticed that a lot of those people are overweight. They're fat. So we're now starting an obesity program. And they were in a rural area where there was a lot of pig farming, hog farming done. And he said, we got one of the farm implement people to put on a farm safety program for us. So, I mean, these people just took it and ran with it. It was just, as I say, it probably was the most profitable thing I can recall ever doing.
I think some of the other statistics is that late-stage cancer diagnosis decreased by about 75%.
Oh, yeah. People came in and got checked. They didn't wait until the lump was so big they, had to cover it up to be
Yeah.
to avoid public scrutiny. So, yeah, no, people, they just did a fantastic job.
And I assume it's still going strong.
Oh, yes, yeah. I'd just love to go back there today and visit with those people again. They are so fine, and they were so, at first, very cautious with us. But then once they found out that we were truly doing what we said we were going to do, they just welcomed us warmly, took us into their homes, couldn't do enough for us.
Was there any type of a language barrier?
Yes, but we had interpreters all the
Okay.
time. And one of the gals that I still correspond with was the interpreter I've had for 3 years, and she is now, she's had some very interesting jobs. She spoke 5 languages, and so she had some very interesting jobs for the British government after we were there, and then for some pharmaceutical companies. She was interpreting for them and working all over Europe. So
Do you think you'll ever get back over there?
I doubt it now.
Be nice if you could.
It sure would. Yeah, it really would.
I think that the other statistics that I found that the rate of infectious disease and ambulance calls and hospitalizations dropped by half.
That I think was probably true, and the reason was that they had a very perverse payment system over there. They were actually paid by people who were in the hospital. The hospitals were paid that way. So they had a penchant to keep people as long as they could, and you'd go in the hospital over there and people would be walking around in their street clothes. I mean, just spending time. But all of that really was changing because they were facing the same financial crushes that everybody has in healthcare. And so they did a great job. They just did.
Well, other awards that you received are Physician Citizen of the Year and Presidential Volunteer Service Award and Citizen Laureate Award from Prairie du Chien. How much do those mean to you?
Well, a lot. The Presidential Award thing was the Ukrainian service. The Citizenship Award was, I think, because of all the things you saw in the CV there, the team physician and the various offices I held in the community, and one of our nurses nominated me for that. And then the Laureate Award meant a great deal because it basically recognizes people who have done special service for the city of Prairie du Chien, the community, and so that was very nice to receive that as well. And I've been very fortunate in that I've been given great opportunities and have worked with great people.
I'm sure Prairie du Chien feels the same about you.
I hope so.
Thinking back to your tenure at Farrell and Gunderson, what would your colleagues say that you're known for?
Probably my sense of humor.
Is that what you should really be known for?
Well, I always thought I was a very caring physician, and I really tried to develop close relationships with my patients. And I guess the most humbling story was they had a retirement party at the clinic for me, and this elderly lady from a nearby town came in and grabbed me and said, Dr. Garrity, what are we going to do? You're retiring, and Ben and I have been your patients for 35 years, and how will we get along without you? And she said, is your nurse Nancy retiring too? And I said, no. And she said, oh, then okay, that's all right.
Go ahead and go.
Go ahead and go, as long as we got Nancy.
Oh. Do you have that's one favorite story, but do you have any others in your experience, maybe a best, worst day, a patient that changed you?
You know, I have had so many patients that I think changed me, and we started hospice in Prairie du Chien, and I was behind that movement. I had heard Keebler-Ross speak in Chicago, and so actually Prairie du Chien had the first Medicare certified hospice in the state. And we had just fantastic people working with it. The nursing and aides that helped these people were just unbelievable. And anyway, this lady's first name was B, and I was seeing her on weekends on rounds. She was another doctor's patient. And I came in, and she's terminal in the hospital at that stage, and most of our patients in hospice died at home. But this lady had reached a point where she needed constant care, and so the nurse and I went in to make rounds, and she immediately says, oh, you delivered one of my grandchildren. I want to thank you for that. And she goes on talking about this, and finally when she left, she said, I have a registry over there. Would both of you sign it? And I want something cheerful now. She said, you know, I'm sick and tired of all this grief and crepe hanging. I write something clever and happy. And I got outside and I turned to Karen and I said, did we just make rounds on her, or did she make rounds on us? I mean, and we both just laughed. She was so positive and totally unafraid of dying. And then I have another friend who was a patient, and she actually wrote a book while she was in hospice called The Divine Art of Dying, Karen Spearstra. And Karen, very deeply religious woman, married to a Lutheran minister, And she just was inspirational. I mean, the way she approached this entire terminal part of her life, and I'm sure she's going to, through her book, help a lot of people.
If you could change one thing in your years of practice, what would it be?
I'd be younger. No, I really enjoyed what I did, and I will say that there's some, I don't know if other physicians have it or not, but there's a time, I think, between 55 and 60 when night call becomes really a burden. And I delivered 1,625 babies, and someone said, "Don't you want to go for 1,700?" And I really had to say no. I didn't think that...
1,625 babies.
1,695 I delivered, yep.
Do you have any advice or words of wisdom to offer young physicians going into the field of medicine today?
Yeah, I do. I would tell them there's so much hassle with rules and regulations, and there's a certain amount of it you have to put up with, but some of it you can pass off to the people in administration and let them handle it, and you can just concentrate on building your patient relationship and taking care of your patients. And I think that's the biggest piece of advice. And secondly, remember that the term is family medicine, and you're never going to be a true member of the family, but you're going to be related to the family, and that turns out, I think there's a tremendous amount of healing potential. It's just in that relationship alone. And so I don't think you should do anything but respect that and try to see that it grows, that relationship grows. And the last thing is that I just talked also yesterday to a high school classmate of mine, and we also were in medical school at the same time, Bob Ware, out in California. And Bob and I have been writing back and forth, and he's been very prolific in family practice literature as far as things like home safety and immunizations and advice he gave his patients, and his little pamphlets he developed became widely accepted. And he wrote to me and said, "I'm glad to see you failed retirement along with me." And I thought about it, and I thought that's really kind of nice. And he just yesterday was talking about the fact that we have such a shortage of physicians, and everybody gets to retirement, and you'd certainly like to say, okay, I can now do this, I can, but you can only play so much golf and bridge and tennis and whatever else you want to do. So I think that everybody should look at some opportunity to stay involved after they have officially retired, and on a much reduced schedule, look for opportunities to serve in places like St. Clair, Ukraine. That's been a very rewarding retirement for me, and I think it's not for everybody, certainly. I've known people who walk away and never look back, but I think the majority would like to still stay somehow involved. And the nice thing is with St. Clair's and the Ukraine, we're not involved with administration or anything else. Someone else took care of that. All we had to do was be doctors.
30 hours a week would probably feel like a vacation to you.
Well, I've got plenty of time off now, and but it's I can't tell you how important a place like St. Clair's has been to me. It's just been, and as I say, the group, it's like I see all the guys I used to practice with here. They're all over there, and so it's a lot of fun. It's fun.
As it should be.
Yes.
Yes. You've been a steady supporter of the foundation. What motivates your giving?
The history here, the foundation, the outstanding educational programs they've had, the I have known so many really outstanding doctors and worked with so many of them, and known the leadership of the foundation for a long time, and their goals and aspirations are just terrific. They help from the bottom up where there's a need, and also the educational programs are the ones that I'm most familiar with, and they've been very, very productive.
What are you doing in your retirement besides St. Clair and other activities? Are you a golfer?
I'd like to be. My timing with my own illnesses hasn't been good the last 3 years. I still pay my dues, but I don't play as much golf as I'd like to. And I think if one other advice I'd give to young physicians is when you want to travel, and if you can, travel, because I think Marianne and I, if we would have one regret, it's that we had some great trips, but I wish we'd had more of them.
You have children, grandchildren?
4 and 7 grandchildren.
Are they close by?
Yes, yeah.
Good. And you have a niece, actually, Sheila, that's the director of the Lacrosse Community Foundation.
Yes, indeed, yes.
Mm-hmm.
Mm-hmm.
Is there anything else that you'd like to share?
I can't think of anything, and I just, I look back and really feel very grateful for the opportunities that I've been given, and I sincerely mean that. Life is what happens to you when you're making other plans, and that's about the way I feel about my life. Winding up in medicine rather than as a funeral director. Nothing against funeral directors. I hope to have been a partner with my brother Bob. But meeting Marianne, having the kids, the grandchildren, association with Gunderson, opportunities after retirement, those are blessings. They really are.